Now we're excited to move into lightning talks from two of the teams who focused on the challenge of enabling state and local governments to track the spread of COVID-19 in their communities. First, I'll hand it over to Ross from Lifepoint to kick it off. Over to you, Ross.
Great, thank you, Anna. So I'm going to get started here by just providing a little bit about Lifepoint and then going a little bit more into detail on our reporting hub. So we have been in business for over 20 years, and we focus on the ability to integrate with clinical laboratories, both hospital and commercial laboratories, and connecting them to physician practices. So we have over 10,000 practice connections, and we process billions of transactions annually. Below are just a sampling of some of the clients that we've worked with in the past. Now, as a response to COVID, we've added several features to our core focus to meet the demands of the COVID pandemic. So a few of those are our patient access portal, which has been providing patients instant access to the results, and we notify them of positive or negative results. And we also have this available on iOS and Android. We also have a provider portal, which provides secure access to providers to get their results for their patients. And then also in a employer-based portal, which helps employers get their employees back to work. And then lastly, which we'll talk a little bit more about today, is our reporting hub, where we report public health data to each jurisdiction. And we've processed well over 10 million results to those states and waters as well. So before I get into our solution, wanted to mention some of the issues that we've seen along the way. So we recognize that that COVID pandemic, as well as the integration to these public health departments, was lacking certain key identifiers that are required not only by the CARES Act, but by these public health organizations to be able to receive the data and provide contact tracing more accurately. And this really comes into play with rapid tests and point of care testing. So testing that you're performing at your house or at a urgent care center. We also found that there were resource constraints both at the laboratories and at the state levels, as well as the point of care and rapid test manufacturers. It just wasn't something that they were equipped to do and had the experience with. So here's just a quick diagram that illustrates how we do what we do. And this is an example for both laboratory and point of care or over-the-counter based tests. And essentially what we do is we build an interface or a connection, meaning we take information from a lab information system or a instrument manufacturer, and with some of our partners, they have a mobile application where they're collecting patient information, and we build that connection to those systems. We consolidate or normalize or harmonize that data within our hub, and then from there we're able then to pass that data downstream to each of the state health organizations and then to federal organizations as well, ensuring that we're getting the most accurate, most up-to-date, as well as the best data we can to those state health organizations. And here's just a quick progression of the process. So the first step is the patient registers in one of these applications. The next step is that they collect the information, collect the sample rather. So most of the time it's a nasal swab, and then they're squeezing some of the solution onto the test cartridge, and then the test is actually read on those devices. And here's where we then get the data to our Lifepoint hub, and then from there, then we're transmitting that information downstream to public health organizations as well as Waters, which is the HHS connection. So thank you. And if you need more information, you can always reach out to us at sales@lifepoint.com. Thank you. And back to you, Anna.
Thank you, Ross. It's great to see how you utilized your existing technology to address this incredibly complex and important challenge and worked with so many stakeholders from state and local jurisdictions to get them the data that they need. Next, we'll turn it over to Raphael from NetMedical.
Thanks, Anna. Hi, my name is Raphael M. Rubio, and I'm the president here at NetMedical Xpress Solutions. And I would like to tell you a story about our platform, Telemed, and COVID-19. I joined NetMedical in 1999, right before the IPO. We were a .com company, if you can imagine that. In that time, we've built a lot of telemedicine solutions, including solutions for mobile radiology, for long-term care facilities, and cardiology and stroke consultations. And you know, we've been through the 510K process for software development. We've served millions of patients, and not once did we ever think we'd be reading a paper about an unidentified pneumonia outbreak on a cruise ship, you know, thinking what was going to happen to the world. In our story, the first effects of COVID-19 that we saw a precipitous drop in the number of stroke consultations that we were handling because the lockdowns either kept people at home because they were scared to go out or because they didn't have access to care at that time. And it occurred to us that our work with the long-term care facilities for tuberculosis screening was extremely relevant, right? We had done the data collection and the imaging and the orders and the diagnostics, and we were doing all of that remotely already. So in 2020, we added COVID-19 lab or test management, I should say, and data management to our platform, because we believe that it is a telemedicine problem at its heart. So if you fast forward to the end of 2020, I'm sitting on a town hall FDA call, listening to Tim and Toby talk to test developers, and I feel like I know them pretty well now after the number of weeks of attendance. But anyway, they mentioned this COVID-19 at Anywhere Diagnostics Design-a-thon competition, and we realized that our platform could be extended with a Bluetooth API to provide the capability of sending in wireless test results on an open standard. And we learned about the Waters database, and we learned about, you know, the at-home testing requirements for getting you know, lab data at home and into the Waters database. And that was our submission, you know, was kind of Telemed with, you know, an API addition to it, and it did pretty well for us. We got a bronze prize in that competition. But that led us to this, you know, the TOPx project, and we started looking at demographic data collection. And we want to understand what data is really useful now, you know, going forward beyond just whether you were positive or negative. And we looked at equity of response data as a broad category, and employer requirements and breakthrough test requirements. And we realized that flexibility in the platform was going to be key. And that's what we ended up doing, right? We ended up adding the ability to add new data fields quickly and add new imaging pathways for selfies and test results and barcodes over MMS and all kinds of technical stuff. But it led to a lot of what we believe are good customer wins here, right? So if you need to do non-standard demographic data collection like the state of California, we've got an answer for that. And if you need to act on strict reporting requirements like the 4-hour employer requirement in New Mexico, you know, we have something for that. And the public can even report on our platform if they wanted to, their at-home tests, and get it up, you know, to the Waters database and use it for verification if they needed to. So you know, our story has led us to having our platform extend into the COVID-19 space and helping us. For us, we use it as a mobile lab, right? We use it for testing employers and groups as a mobile lab, but we could use it for much more than that now. We've added all these features, and we want to be a trusted third party that's already a medical company to help people solve their COVID-19 data management solutions. And we think we've made something that's really useful to the public. So with that, I just like to say thanks to everyone at HHS and Census for including us in this, and we hope to see everybody in the product workshops, and I'll turn it back to you.
Thank you so much, Raphael. It's exciting to see how you were able to so quickly adapt your telemed platform to the COVID-19 pandemic by incorporating so much data and enabling great flexibility for states and localities. Now we'll hear lightning talks from two of the tech teams who developed tools to empower organizations in making operational decisions based on COVID-19 testing data. First, we'll turn it over to Allison from UDoTest.
How do you know when it's safe for all of us to go back to our offices? I'm Allison, the CEO and founder of UDoTest, an at-home disease testing software company. I founded UDoTest 8 years ago when I needed to go for my pap smear in South Africa. And what I quickly learned, however, is that cervical cancer was killing 15 women every day in my home country. Now that was unacceptable to me. So fast forward 8 years, a wild adventure, many awards and thousands of lives saved. UDoTest has won global awards. We now work with 15 plus national and regional labs across the country. We offer upwards of 78 diseases that can be self-collected in the home, including chronic disease, metabolic, cancers, flu, etc. And our most recent HHS award has dove us directly into the COVID OTC testing world. Our most exciting news is our work and our integration with Recuro Health as of this spring. Some of the clients that we serve and are proud to serve today with a customized at-home testing solution for them are folks that you can see on your screen right now. And through the TOPx program, we've been extremely fortunate in working with even more user cases. So those include folks from your companies, your large companies who have upwards of 50,000 employees in some cases, to folks in hospitality, as well as travel and leisure partners. What these folks found really helpful about our solution is that we can help them with their own reopening strategies. And the flexibility of our system is also really important to them because they can do either weekly testing or on-demand testing, both in the US as well as outside of the US. They really appreciate the opportunity to instill confidence in and amongst their customers who want to come back and use their facilities, but also safety amongst their employees and enabling them to feel safer. It instills this confidence. It is a secure infrastructure, and our live dashboard gives them the tools and capabilities to safely make rational decisions. And a quick example of how our user journey might be experienced when an employer works with us is they get a hold of the test, they issue the test to their employees, and they register various portals on our platform. From there, the information is captured and verified to ensure that it is a valid test, and various consents get captured at this point. The patient then completes the test. There is a wireless transmission of information that goes from the test itself back to our system. And last but not least, our system then reports the results to the patient, the employer, and the state and federal government repositories at that point. An example of what our employers can experience in a customized dashboard of tools that help them to make rational decisions include information on the test, the lab, the physician, who to contact, the results, etc. And our service is absolutely live and is helping many clients today, but we focus on your large to mid-market employers, your carriers, your telehealth providers, can service your government agencies, have served schools, and absolutely have a focus of more broader integrated care, which is what our passion is, because we do not need to be in this situation again anytime soon. So if you are a payer or a provider or an employer looking for a solution to reopen your workplace and to support your employees and your customers, contact us. I'm Allison, the CEO of UDoTest, partners at udotest.com. Thank you.
Thank you so much, Allison, for sharing your personal story of UDoTest's inception and the diverse ways in which your product can be used to promote safety. Now over to Linda from DLC Enterprises.
Hi, I'm Linda Carr. I am DLC Enterprises, and I want to share with you one of our solutions called Co-Verify. It is our reporting solution that we've developed. So when Co-Verify first came about, it was basically designed from a solution that we had put together in 2018. Then, of course, COVID happened and everybody got sent home. And it had originally been planned to be research. We had planned on the application to be for reporting and such. But then we found out that we had the ability to make use of this data and not only use it for research, but also be able to add to it so that people could actually get their results more quickly, so that employers could get their results quickly, and so that we could send data over as needed to agencies, to the states and the counties and those types of things. And then even further on, as we worked more and more, especially with the TOPx and the HHS folks, we found that we could also add things such as the vaccine passports and the ability to do some other things, which I'll share with you here. So what I wanted to do is kind of show you very quickly, within our Co-Verify application, you'll notice that we have the ability, we have 3 different areas that we cover. I'm going to briefly kind of go over what happens with a particular patient. If they happen to feel sick, they would log into our portal. And when they log in, they would click on the patient, the little patient circle that you see there at the bottom of the screen. They would register if they hadn't already. They would then log on, select which one of the clinics that they wanted to get their test from. They would then schedule it. It would then send them an email, as well as if they hadn't previously scheduled, it would send them a QR code so that they could then share that QR code when they went in to get their test. They would then get their test, all right? Or in this case, you know, this particular person happened to getting a vaccine as well. So after that information, after they had done that, then they would immediately get, within 15 minutes or however long it takes for the lab to send the data either wirelessly, or if they are directly connected to us via, some of our customers have directly connected right in with us so that they schedule their patients, give their patients their tests, and then literally within minutes, the user has the information, it goes to their phone app, and then they also it goes to CDC or the state or wherever it might need to go. If it's a lab only, the lab would have a whole list of people, they can schedule them, they can actually get their tests, upload them again. You know, it doesn't have to be the patient that's initiating this information. It can be almost, it can be either the lab or the patient or even an employer. One of the things that we've done with Co-Verify, we've worked with a number of states and counties and schools even to be able to provide them with a way to get all their people back to work. And that seems to be the biggest thing that we want to do nowadays. The other thing we've done is we have some future plans. DLC is working to try to not only provide what we need today, but to make sure that we're ready for tomorrow. Okay, so one of the things we've done is we've developed a little QR code that has, we have one not only for the vaccines, but we also have one coming out shortly for STDs. And one other thing, and we just saw this happening today, actually just a little while ago today, with someone had whited out someone else's name on a card, and their employer said, wait a minute, this doesn't look right. They actually contacted us, and we were able to provide them via something that we've already built into our environment, the ability to send directly, provided that the customer allows it, directly to an employer, a copy of their vaccine card or their health card. So first of all, we really appreciate the opportunity that we've had with HHS and Census to do all of this. And we're hoping, and if someone needs something, we're looking forward to working with you on the 25th so that we can go through and show you even more. Thanks again. And if you need anything, please don't hesitate to reach out to us. We're very happy to talk with you. You'll see my phone number and emails are both here. Thanks very much.
Thank you so much, Linda. It's amazing to see how quickly you were able to found and launch this company and create solutions for patients, laboratories, and employers. We look forward to seeing how all of these products will continue to grow and scale to use cases even beyond COVID-19. Now we're looking forward to hearing from 2 of the tech teams who developed solutions to address the challenge of helping consumers and businesses manage testing data. First, we'll hear from Ajintha at ClinIQ.
Hi, everyone. We're from ClinIQ Health. One World, One Health. Our focus is on border biosecurity and biosafety. My name's Dr. Jintha Pathmanathan, and I'm the founder and CEO. As we know, 9/11 and COVID has changed travel and tourism forever. The past year has seen a dramatic decline in passengers and tourists to many locations. We're starting to see a recovery now with active testing and vaccination, and also health credential solutions coming to the market. We anticipate return to full recovery in about 2024, still a number of years ahead, and we also need to anticipate future disease threats and put solutions in place to prevent them. As we know, it's been a confusing world. Different countries have different eligibility requirements for travel, different proof for health credentials. There's fake COVID tests crossing the borders. Toronto recently fined a traveller $9,000 for a fake test result. The aviation industry is calling for health credentials to be backed by the administration. There's operational inefficiencies caused at airports and other locations due to the extensive checks. And now the travel and tourism market has had to dive headlong into the health market. They have to provide healthcare solutions, which is adjacent, which is not something that they're used to. So we're here to simplify the process and bring about a global interoperable solution. One world, one health, and one pass. Our solution's quite simple. We'll have one global map with testing, verified testing clinics and laboratories, and also vaccine sites from around the world. One platform where you can purchase your verified tests and you can follow through with getting your results. Our one travel pass system means that we integrate to a number of travel pass solutions. We have a strategic partnership with IATA, the International Air Transport Association, with its 270 member airlines. We also provide for at-home tests on our platform and provide support through telemedicine. So you can purchase your test when you go to travel, and you can have your doctor at your global location assist you with the results and sample collection. We have a number of partnerships. We're now in 8 countries with over 450 clinics and laboratories coming on board. We've just commenced 2 airline trials this month with international carriers, and we have 3 airlines about to start. We're working with a number of universities around the world for staffing and intern placements. And we've also partnered with the 3 cloud providers, Google, AWS, and Microsoft. We're a global platform, but we work with local communities. We're working with universities, as I mentioned, to recruit a diverse, multilingual and multicultural intern and staff base. We want our teams to reflect the patients we serve. So let's travel again. It's safer with ClinIQ. You can contact us through our email at clients@cliniq.health, or simply go to our website, https://cliniq.health. Thank you.
Thank you so much, Ajintha. It's fascinating to hear about how your product will help consumers and businesses turn to the new normal surrounding travel. Next, we'll turn it over to Ken from Safe Health.
Thank you very much. I'm Ken Mayer from Safe Health. We're a partnership with Mayo Clinic. They have about 35% of the business and are very actively involved. We've developed an integrated digital health and connected diagnostics platform that enables rapid implementation of custom digital health applications that can be quickly set up, configured, even white labeled to service the specific needs of different populations or use cases. I'm going to take you through Health Check, which is a solution we built for employers and educators for managing ongoing COVID-19 testing and vaccine status verification. The system was developed so that employers and educators can have the freedom to allow their constituents to either be tested or vaccinated. We are tied in with the electronic health record systems, state vaccination registries, EHRs, Apple Health Kit, and Common Health so that we can electronically verify vaccination records of employees or students. We also have developed an integrated rapid test system that enables employees or students to do their testing at home. This allows educators or employers to allow their users to scan tests. I'm going to walk you quickly through the workflow. There's a self-assessment, which allows the end user to report any symptoms they may have. They then get walked through a step-by-step collection process. There's a timer, and then when the test is processed, they can scan it with their phone, and the results are automatically returned utilizing an AI-driven computer vision algorithm. The results are then presented to the end user. If the test is positive, there's a built-in telehealth triage system where a licensed provider can have either a synchronous or asynchronous consultation to action next steps. And then ultimately it updates a visual passport that's also tied in with a credential system. And you can see there the QR code, which abstracts the person's personal health information, but allows the educator or employer to actually utilize that information to grant access or deny access. There's a robust admin console that provides advanced data visualization and all of the tools to manage the entire system. There's a lot of configuration features for things like type and frequency of testing, adherence reminders, so on and so forth. We've enabled a number of tests from leading developers on the platform. Q Health is a rapid molecular test that was approved for over-the-counter use. It gives you results in about 20 minutes with a simple nasal swab collection process. Again, it's authorized for use without a prescription, and there's no special training or certifications required. It's tightly integrated with the Health Check platform so that the results flow through to the verified status access control passport. Another test and partner is Quidel. It's a rapid antigen test. The results are returned in about 20 minutes, and it can be scanned using the smartphone RDT reader system, and again, used to update the passport status. This test is low cost and available in high volumes now. Again, we're a partnership with Mayo Clinic. They cooperate Health Check with us, and a lot of the protocols that are used within the system that are offered by default can ultimately be changed by the end user admin. Were developed by Mayo Clinic. So that's our presentation for today. If you have any questions, please feel free to contact me at ken@safehealth.me or visit us at safe.health. Thank you very much and have a nice day.
Thank you so much, Ken. It's amazing to see how your partnership with test developers and the Mayo Clinic have resulted in a product that is so usable by such a wide array of stakeholders. We're thrilled to see that all of the teams in this sprint have worked to collaborate with so many different organizations.